Hey, Viola, I hear there's a new street drug out there.
Wow, there's so many new street drugs out there, and we need to get to the bottom of this. But that'll be today on Medical History Mystery.
Hello, everybody, and welcome to Medical History Mysteries. I'm Dr. Pam Maragliano-Muniz, Chief Editor of Dental Economics. And with me, as always, Dr. Tom Viola. Tom, how's it going?
Good, Pam. How are you? Everything all right?
Everything's great. Now, I heard that there's a new drug out there for people to take. Tell us about it.
Well, it's a new old drug. How about that? Xylazine, spelled with an X, xylazine, has been around for a long time. It's a veterinary tranquilizer, but it was originally invented as a tranquilizer for humans as well. Xylazine is an old drug, as I said, but with a new purpose, and that is to heighten, to enhance the effects of opioids and other central nervous system depressants, as well as stimulants. And it's been found more and more in doses of fentanyl and heroin, without anyone knowing it, obviously, to amplify the effect, to boost the effect.
How's it taken?
So it's taken like every other dose of opioids. So if you're using heroin and there's xylazine in there, if you're smoking heroin, or if you're injecting heroin, or even taking heroin orally, which you can in very pure doses of heroin, you'll get the dose anyway. It's known as tranq dope. That's the terminology on the street, which is you don't expect to have a tranquilizer in with your opioid, and so that heightens that effect. We're still trying to understand how it happens or how this drug became so widely popular, but this is deja vu. We've faced this before with fentanyl. We didn't see fentanyl coming as a street drug, and all of a sudden it's everywhere. And the problem is when you combine medications, or drugs in this case, that have the same effect, like central nervous system depression and respiratory depression, that is increasingly dangerous. That increases the risk of things like central nervous system depression to the point where patient loses consciousness, or respiratory depression, which in advances to the point where the patient stops breathing.
This is scary. How can we as dental professionals educate our patients?
I think the first thing is making patients aware. Okay, and it's not something that comes up in conversation every day, that's for sure. But awareness on our part means that we know that if there are patients out there that do recreational opioids or do recreational benzodiazepines in powdered form, especially, that they know that there's this drug out there, that this drug's called xylazine, and that they will experience enhanced effects. And at least, if the conversation has started with, yes, I do substances, occasionally I do, recreational drugs. They don't have to tell you much more than that. Just say, hey, have you heard of this new drug called xylazine? Some people say to me, well, you don't want to make people who use substances aware of this new drug. But I think in this case, awareness helps save lives, because if you know that drug's out there, then at least if you're getting symptoms of rapid respiratory depression and rapid central nervous system depression that you normally don't get with whatever dose of recreational opioid you're using, then at least you can seek help immediately, because time is of the essence.
What can happen? Is there a reversal agent for xylazine?
To my knowledge, there is none, and mostly it's supportive therapy. But we can use drugs that reverse the opioid-like effect with opioid blockers. But as far as I'm aware, there is no xylazine reversal agent. I think it's just supportive therapy. Again, things that we normally do in an ER to support someone while they're going through a bout of respiratory depression.
Now, I don't think this is a stretch, so I'm just going to ask anyway. If somebody came in as a patient who was under the influence of an opioid, and we might not even realize it in some instances, and it was laced with xylazine, are there special dental considerations? Obviously, it'd be great if we identified it and we said, today's not a good day for an appointment. Let's get you help with your, some primary care type help or emergency help. But what if, a patient's scheduled for something, we don't identify it, and we start pulling out local anesthetics or something like that?
That's why I'm a big fan, and not everybody agrees with me. I mean, it's one more thing you have to do, but I'm a big fan of pulse oximeters in the dental office. I think that if you can measure a patient's oxygen saturation, you get a better chance of understanding what may be going on. If it looks like they're under the influence of a substance, if it's not normal behavior for them, if they're not usually hypooxygenated and for good cause like COPD or something, then running the oximeter at least gives you an idea of, okay, where are they? And therefore, you're not even going to start treatment. You're going to seek emergency services as quickly as possible.
Wow. All right. Well, this is great advice. The sad part is I feel like I'll be talking to you next week and there'll be a whole new drug available for us.
Wouldn't surprise me, but we'll be on top of it because that's what we do here at Medical History Mysteries. So it's all
Yes,
good.
we do. So follow us at Medical History Mysteries on dentaleconomicsofficial.com, and we will give you some new information next week. And I can't wait to see you then.
Same here, Pam. Thanks so much.
Thank you. Bye, everybody.